show where we talk about beauty, health, fitness, and much more. So stay tuned because you are not going to want to miss this one.
That's right, y'all. Today's show is with Dr. Omar Haye. He's a board-certified acupuncturist, medical doctor, adjunct professor of alternative medicine, retired military vet, member of the Florida State Oriental Medical Association, and the list goes on. Dr. Haye has taught microbiology, pharmacology, toxicology, Chinese medicine, and acupuncture. Oh, and so much more. But we're going to stop at acupuncture because acupuncture is the topic of our show for today, and I am so excited to have him on the show. So Dr. Haye, thank you so much for being here, and we are going to just dive right in. So you started out at UAG School of Medicine, and those of you who don't know, UAG is a top international medical school in Mexico. And Dr. Haye went to become a medical doctor and then later transition into the field of acupuncture to then become a board-certified acupuncturist. Dr. Haye, this is a lot of schooling and a lot of ambition. Please tell us, what was it that made you decide to merge into the study and practice of acupuncture?
What inspired me to be a physician was that my father was a gastroenterologist, did GI work, and I really liked how the job looked and felt. It was a chance where you could interact with people skills, and you could do science and hard mental work. And it was just a chance to be a well-rounded individual and make a difference in other people's lives. Acupuncture was a slightly different avenue that I went. I was already a physician at the time. I was an Army medical officer, and I had gotten injured, and I had been sent to an acupuncturist because a lot of things that I was doing wasn't getting results, and they kept proposing a surgery, and I did not want the surgery. So I felt like, I'll try this. I've never heard of acupuncture, but it can't be worse than what I'm doing already, right? So I went, and the guy that I met did a fantastic job. Got me back together about 75% better over like 6 or 7 months, and it just changed my whole perspective on medicine and opened my mind to the idea that maybe there's another way to do this. And just because I don't understand how they're doing it doesn't make it any less valid than the medical skills I've already learned.
I totally agree. I think that's an amazing transition, starting off as an MD and then merging into acupuncture. It's like, you don't knock it until you try it, and you tried it and you got amazing results. So that's awesome. Now, Dr. Haye, can you talk to us about what acupuncture is for those of us who don't really understand, and give us a little background on it?
Of course. Acupuncture is a system of medical care that really tries to promote the body's ability to heal itself. A lot of people think that what we're doing is that when we put the needles into the body, the metal or the practitioner or something outside of the body is what's causing the healing. Really, all that we are doing is trying to activate certain parts of the body to heal itself. Our goal is to move chi and blood. You've all heard of blood, but you may have not all heard of chi. And chi can be interpreted as energy or things of that nature. But from a Western medical perspective, let's try and think of it like oxygen. All right? That's a good way to try to think of it from a modern Western perspective. And our goal is to bring blood and oxygen to injured parts of the body to promote self-healing. Right? That's the goal. That's the mission. And how do you pick where to put the needles to promote that self-healing? Well, it's a system that looks at body organ systems and draws lines or pathways around the body, into the body, all through the body, connecting certain organ systems with other organs, with your emotions, with muscle groups, with tendons, the fascia itself. And we can pinpoint with a map mentally or in an app or in a practice doll, or even sometimes just with sensation by touching the patient, palpating to find the pain. We can find these points along these pathways that wind over and under and through the body, and then strike and press right there with the needle to activate that self-healing, to move the chi, move the blood, get the oxygen flow, and help the patient heal themselves.
Yeah, absolutely. That's definitely a great way to put it. So now, the next question I have for you, Dr. Haye, is what are the most common issues people come to you to treat? For example, do you see more internal issues such as digestion, or do you see more external issues such as back pain or neck pain? And this is also one of the questions that one of our callers has. So I'm going to go ahead and let you answer his question, and then afterwards you can go into more detail.
Hey, this is Steve from Orlando, Florida. I kind of have two questions. The first one is, what are some conditions that could be treated with acupuncture? And the second is, how often should you get acupuncture treatment? Thank you.
There are a wide variety of conditions that we can treat with acupuncture. The one that brings patients in the most is usually low back pain, migraines, or stress. Those three are very common here in America. We can also, from there, we can branch into things like type 1 or type 2 diabetes, high cholesterol, acid reflux. That's a great one we can fix. Knee pain, so any type of joint or muscle injury. I've treated latent seizures, some Agent Orange exposure. I've treated Parkinson's, anything with a tremor or loss of function we can do. Bell's palsy is a big one for us. Bell's palsy we treat constantly. It's a big deal for patients, but we see it so often that we're like, oh yeah, we can do Bell's palsy. How often you should get treated really depends on what the condition is, right? With Bell's palsy, you have to treat it every 2 days for like 3 weeks, but then it works completely. For stress, you might want to go once a week. That might be enough, right? In China, obviously, it's more culturally accepted, more culturally known. So patients come in for treatment 3 times a week for everything. In America, we're not quite there yet, but if you can get in once a week for a condition like a shoulder or a knee, or a migraine headache, I think that's sufficient. You can go 2 weeks, but anything beyond 2 weeks, I say don't. If you can't commit to coming every 2 weeks at the minimum, then you shouldn't start the program, because you won't get the results you need. You'll get treated for 1 week, and then by the time you come back 3 weeks later, you've already regressed to where you were back when you had your first treatment. So you just keep paying to go back and start over. So for you as the paying patient, if you can't commit to at least every 2 weeks, don't start the program until you can have that little bit of time, okay? And that's why I do mobiles, because it's more convenient that way. People are able to keep the schedule that I ask. Great question.
I agree. That was a great question and definitely a great answer. So the next question we have is out of Fort Lauderdale, Florida, and this is regarding back surgery and persistent numbness.
Hi, this is Mel from Fort Lauderdale, Florida. And my question is, for a person who has had a procedure, back surgery, and who continues to have persistent numbness or altered sensation from the posterior leg down to the toes, what are some recommendations for from an acupuncturist, if there are benefits to acupuncture for a person who is dealing with such a circumstance?
For a patient with back pain and increased numbness of the lower limbs, acupuncture is perfect. Perfect for this. We specialize so much of our time and energy in low back ailments. It's usually going to be a problem around L4, L5, or S1. Those are discs in the lower back. Maybe herniation, something along those lines. We have protocols just for that. I prefer E-stem in that area. We can surround the area and do tiny electrical stimulations into that zone to promote blood and chi. Also, for something like this, we're going to have to do some lifestyle changes. We're going to see if our patient is overweight in any capacity. If so, we can dropping as little as 10 pounds can really, off of the midsection, can really take some strain off the lower back and hips, right? And the next thing after that, we're going to have to take a look at maybe some exercises. There's a great machine called the reverse hyper. You can usually find it in a traditional powerlifting gym. It's a very obscure piece of equipment, but it's perfect for lower back herniations and numbness and strengthening that lower back while stretching it out, right? To help decompress the vertebrae. So yes, an acupuncturist is well suited for lower back pain with numbness. I treat it, I would say, every 2 weeks. Literally those exact symptoms. So yeah, acupuncture TCM is perfect for that as well, with a little bit of dietary changes and some lifestyle modifications around exercise. Totally.
Okay, so there you have it. And as you heard, lower back pain is definitely something that Dr. Haye treats and is very familiar with and treats about every 2 or so weeks. So even with back pain, guys, and increased numbness of the lower limbs, it's definitely treatable with acupuncture. All right, let's go to our next caller. Our next caller is also from Florida. She's calling out of Orlando. We have Miss Lucy on the line. Lucy, go ahead and state your question.
Hi, my name is Lucy and I'm from Orlando, Florida. And my question about acupuncture, considering that I really don't know much about acupuncture, is it or can it be used as a form of therapy, such as meditation or yoga? Is it something that you can incorporate into your regular everyday life, or is it more of a treatment to treat something in particular? I would love to know. Thank you.
Great question. And the answer is yes. Acupuncture is most definitely used as a form of meditation. It works very well because its main purpose is to help balance the yin and yang within a person. And when that is accomplished, emotional and mental balance is achieved, leading to a sense of inner peace. And honestly, most of my patients end up sleeping through the treatments once the needles are in. So great question. Thanks.
Yeah, that was a good question. And it actually kind of leads us into our next question. In regards to, you stated that your patients experience inner peace and even end up going to sleep once the needles are in. But what about before the needles go in? Does it hurt? That's a question that a lot of people want to know. And we even have a caller from Detroit, Michigan, who has that very same question.
It's Alan calling from Detroit, Michigan. A question I would like to ask an acupuncturist: does, when they stick the needles in your skin, does it hurt? Because it looks pretty painful.
Do the needles hurt? Is the single most common question that we get. And the answer is usually no. Now, some parts of the body are more sensitive than others, like your face, hands, the soles of your feet. Those places, if you get needled, you'll feel it. You'll feel the pinch. Other places, not so much. Also depends on each patient's individual pain threshold. If you're someone who's used to a lot of pain, you may not notice it. A more sensitive person may feel it right away. It also depends on the practitioner's technique. Some patients prefer to feel the stimulation right away. Some people prefer a softer stimulation. So the physician has to kind of tailor their approach, their technique, to match the patient's desired outcomes. And furthermore, if it does hurt going in, it shouldn't last more than a few seconds. If the pain persists for more than 3 minutes, then by all means tell your acupuncturist and they'll take the needle out, see what went wrong. Maybe they hit a nerve, which happens, it's possible. Maybe your arm moved at an odd angle and the needle, hurt because the arm moved. If the pain persists more than a couple minutes, tell the acupuncturist. They'll pull it out and they'll start fresh. Good question. Very common question. And I get acupuncture every week, so trust me, if it was super painful and terrible, I would not be doing it. But very good question. Thanks.
Yeah, and thank you for clearing that up, Dr. Haye, because a lot of people go in with the notion that, when you think of needles, you automatically think pain. So thank you for clearing that up. That's good to know that it does not hurt. So the next question that I want to get into, and it's something that I find very interesting that many people may not know, is that acupuncture is not just physical therapy. It focuses a lot on the mental aspect of an individual prior to fixing the physical problem. So, Dr. Haye, please explain to us and tell us why the mental or emotional state of a person can sometimes, if not many times, play a major role in the recovery of a patient.
Acupuncture is primarily a physical medicine, but you sometimes cannot separate the emotional component from the physical illness that is occurring. Okay? If you were running and you pull a hamstring, we could just do physical medicine using pathways to move blood and chi, aka oxygen, to the damaged tissues and help you recover. But sometimes the ailment might have an emotional component to it. Right? The most common are GI issues, gastrointestinal issues, right? IBS, irritable bowel syndrome, common Western diagnosis, and there's a lot of debate about what causes it, how can we solve it, what can we do, and the consensus in the West is that there is an emotional component to it, right? Anxiety and stress can cause these GI issues, bloating, diarrhea, gas, all sorts of issues, right? And TCM holds on to that idea that each organ system has emotional component to it. And if we want to truly get to the root of some of these organs' failures or weaknesses, we have to address the emotional component of that organ. I myself have had IBS, stress-induced intestinal issues. That didn't get better as I dealt with my stress, right? Acupuncture was one of the ways that I deal with my stress so I don't have IBS symptoms later in life. Another big stressor is just everyday life. Like we talked about a little while ago, headaches and stress and all that good stuff. I should say all that terrible stuff. If we don't deal with it, it manifests physically. It manifests with high blood pressure. It manifests with shouting and raising your voice. It manifests with chronic headaches, migraine headaches, acid reflux. All of these things that are appearing to you as physical problems, if you dig deeper from the root of the problem, you'll find the root of the problem was that there was stress, some sort of stressor. And with acupuncture and TCM in general, we get a chance to address that stress, to help break that up and help teach the patient how to cope with that stress, how to manage that stress, because you will never, ever have a life completely free of stress. You never did, and you never will. Even when you were a baby, when you wanted milk, you cried. You were under stress. It may have been solved relatively quickly, but there was stress in your life, right? Stress is only a problem when we cannot manage it properly. Then it manifests itself in unhealthy ways. Either unhealthy behavior, like you yell at people at work, or you're homeschooling your kids and you're a little frustrated and you're yelling at the kids a little bit, or you have physical issue. Anytime you walk into the office, you have a headache or you have acid reflux after a long day. What we can do is treat the emotional part of that with acupuncture, while still promoting that patient to seek lifestyle changes to deal with the ever-present stress that is their lives. Because stress is both good and bad. If you get fired from your job, that's a lot of stress. Guess what? You get hired at a whole new job that you really wanted. That's also stressful. There's no way around it, right? And a patient has to work with a provider to figure out how we're going to manage this. Because acupuncture alone will not be enough. Acupuncture will help you get there. But then if you leave my office and go right back to your stressful environment, you have learned no coping skills to deal with that new stressor. You'll get sick again and be back in my office in a week for the rest of your life. And that's not a path to long-term health. So I like to partner and work with the patient in changing their lives. Acupuncture with me, then when I'm not with you, how are you going to handle this new stress that comes into your way? How are you going to handle this old stress that keeps popping back up? And we'll work through it together. And that's where the emotional component really comes into play.
Wow, that's actually a really, really good explanation. And I don't think we really realize that our thoughts and our emotions play such a major role in the health of our body as a whole. Even dealing with acupuncture, as you now explained, I, like most people, just thought acupuncture was more of a physical modality rather than having anything to do with mental or emotional states. So that is very, very interesting to know how important our emotional status plays a role in acupuncture. So our next question, we're going to move on now. We're going to go to a couple out of Germany, and they actually have 3 questions. So go ahead, Christina and Martin, take it away.
Hello, we're Christina and Martin.
And we're from Germany, and we have 3 questions. The first one is there empirically proved scientific data from larger studies on the effects and health benefits of acupuncture?
And the second and third questions are, what kind of training do you have to do in order to practice acupuncture? And can you do it on yourself? Thank you.
Bye.
Very good question, because the vault of that knowledge continues to grow every year. Even though it originated in the East, as it's moved to the West, we've had a chance to do a lot more research on it, gather a lot more data. Whether or not it really works, is it a placebo effect, the nocebo effect, so on and so forth. So yes, there's a growing library of data, and anybody who wants to get in touch with me to learn more about how to access that data, totally fine with me. Go through Roots from Chantel or DM me directly, and we can talk, and I can steer you towards reputable studies that will give you the data that you need. Right now, our biggest data cohort is on low back pain and PTSD. There are 2 biggest studies out, and phenomenal work, and feel free to get in touch with me anytime. We can delve deeper, and I can steer you towards where to find that data. The education required to become an acupuncturist in America is 3 years at an accredited program. We have an overarching acupuncture body called NCOM, and they regulate and the whole field of science as well as the industry. And what they do is they have standards for different programs, and if a program can qualify, they can become an approved NCOM program, and it's 3 to 4 years. Usually it's 4 years. You can do it in 3. I did it in 3. That last third year is really jam-packed. And then you do 4 board exams to get your license for your state. You do a board exam on acupuncture points, a board exam on acupuncture and TCM theory, a board exam on just herbal medicine, and a board exam on Western medicine. Because this encapsulates all the things that a modern acupuncturist will encounter working in America. You will work with Western medicine, so you need to pass the board exam there. You will work with herbs, whether Eastern or Western herbs. So you need to understand that. And of course, you have to understand acupuncture, not just the theory, but also the points that you will use. So it's 3 to 4 years of additional school after college, and then 4 board exams. and then you will be able to qualify for your license for your state. Oh, and you also need to do a clean needle technique exam, which is a physical practicum to prove that you know how to handle sharp needles without giving people a bad experience, how to be sanitary, how to throw things away in a proper red sharps container, how to properly wash your hands, all this stuff to kind of protect patients. So I guess technically it's 5 exams and 3 to 4 years of additional schooling. Good question. And last but not least, can you do acupuncture on yourself? The answer is yes. I do it to myself about at least twice a week. If I'm lucky, maybe 3 or 4 times a week if I have time. But at least twice a week, I treat myself. Now, there's some places you just can't reach when you're alone. Like, I can't really treat my back by myself, but I can treat shoulders, knees, my face, hands, head, stuff like that. Totally, anywhere I can reach with my hands and I can see, I can do. I just can't do my back. That's the harm. For that, I have to go to a friend and be like, hey, go ahead and work on this lower back of mine. But the rest, yeah, I do it to myself all the time. That's probably why I'm usually in such a good mood, because I get acupuncture twice a week. So yeah, good question. Thanks.
Yeah, guys, those were some really good questions. Definitely appreciated. And the information is, that was just amazing. Lots and lots of information. Now we're going to move on to another caller. And this caller has a question in regards to an issue that a lot of women deal with, but don't necessarily talk about.
Hello, my name is Rachel, and I'm calling from Florida. My question is, does acupuncture help with the treatment of uterine fibroids?
Acupuncture in traditional Chinese medicine is great for uterine fibroids and for women's health in general, honestly. We have a lot of different ways of doing it, and it's probably going to be a combination of both needles and dietary changes with maybe some herbal medicine. We can do all 3. I think we can have improvement there. Usually, uterine fibroids can be seen as a type of blood stasis. I mean, we talked earlier about blood and chi stasis. In this case, it's going to be the same thing. Blood and chi stasis in the uterus, or if you would say, the lower jiao. So our goal will be to move blood and chi in the lower jiao. And that will start the process of moving those uterine fibroids out of the way. I have a lot of colleagues. Well, I have one really good colleague who specializes just almost exclusively in OBGYN women issues. She's here in Claremont. So anyone who's in Florida and wants to learn more about, uterine fibroids, stuff like that, I have a fantastic acupuncturist lady that I work with who is amazing at it. So yeah, uterine fibroids, we see it all the time. Yeah, we got you, don't worry.
So ladies, there you have it, uterine fibroids and acupuncture. Who would have thought the two went together? But hey, you heard it straight from Dr. Haye, board certified acupuncturist, that it actually works. So that is awesome, awesome, awesome. And now we're going to wrap things up with a final question from another Floridian. And her question is more business related in regards to advice to or from another healthcare professional.
Hi, my name is Natalie from Fort Lauderdale, Florida. And my question to the acupuncturist is, what is the single most valuable advice you've received from another healthcare professional, or an advice that you would like to offer to another healthcare professional that you have learned on the job?
The best advice I've gotten from a healthcare professional is from my father, the physician. And he said that when you become a healthcare provider, it's a lifestyle, not a job. As in, everything you do revolves around this calling that you're involved in, from your personal life to your own personal health habits, to your relationships. Everything centers around this profession you've chosen. And the patients come first, and you have to do it for them. It can't be for financial gain or social status or anything like that. It's a hard lifestyle choice. You have to commit to it fully. which means you probably should enjoy it. And since I do, it's been a great lifestyle choice for me. Great question.
That was another great question. And you know what, Dr. Haye? I can't believe that I forgot to ask you about chi. What is chi? Before we end this, you have to talk to us about chi and explain it to us in a way that we can understand.
There's many different types of chi. So many different types of chi. There's the chi you get from food, the chi you get from the air you breathe, the chi you're born with. That comes from your parents, right? Like a chi inheritance, I suppose. But there's no true direct translation in the West that would encompass all of that. It's everything and all the same, but it's also different depending on sources and where in the body. And what I really want to get Western thinkers, Western practitioners, Western patients, providers, health systems to think about chi is as almost a metaphor for oxygen when it comes to our treatment plans, right? If we're talking more about the philosophy of chi and the broader picture of TCM, traditional Chinese medicine, then we would have a 12-hour discussion and we'd never get to one solid, definitive answer. It couldn't be done, right? A lot of TCM feels almost philosophical, right? But from a practical standpoint, a usury standpoint, something that you can actually go and make a plan in a treatment protocol and get results. I want you to think of chi as oxygen. Getting oxygen to parts of the body which have been deprived of it, to save tissues, right? Everyone knows in the West, moving oxygen to necrotic or damaged tissues is imperative for recovery and sometimes just salvaging the tissue or organ system from failure. And we use blood to get the chi where we need it to go. Just like blood carries oxygen, right? Blood is the mother of chi. And chi moves the blood, as they say, right? When we say blood is the mother of chi, I want you to visualize blood move and the chi together. Like the blood and oxygen is together. Perfusing, let's say you're having a heart attack, right? Having a heart attack and the pain of the heart attack of your MI, the myocardial infarction, is dying of tissue, of cardiac cells. This is happening. If we can get blood and oxygen to that area, it could help slow that process, stop it, maybe reverse it, if we're lucky. Think of blood and chi as the same thing on TCM. We can get chi and blood to that injured heart. We could help it recover. We could raise its chi, and the heart may self-heal. When we think about it, that's what's really happening. So I want you to think of chi from a Western perspective as oxygen, and getting oxygen to damaged parts of the body to salvage that system. That's a great way to think of it. It's a good way to help speak the language of the culture that we are in, right? If we were in China, maybe we don't have to say that. But in the West, if you're going to talk to patients who may never heard the term chi, or talk to another physician who's never heard the word chi, or a physical therapist who's never used the word chi, then talking about it in terms of oxygen makes a really common language. And with that common language, we can really start to communicate and share ideas, and that's what helps the patient.
That makes so much sense. And I love how you related chi to oxygen and showed the differences of how it's understood in the East, like in China, as opposed to how it's understood in the West, here in the United States. Because you say tomato, I say tomato, same thing. We tend to use different words to understand different things. Some people even relate chi to an energy or a force. But I really like how you used oxygen, because we know we need oxygen to survive. Damaged tissue cells, they need oxygen to heal, to fully recover. So I think that's a wonderful analogy, comparing chi to oxygen and how important it is in TCM in general. So now, Dr. Haye, we are going to get into your practice, what you offer, and how our listeners can get in contact with you.
Yeah, I love mobility in services. Amazon's mobile, Walmart is mobile, your groceries, everything is kind of on your timetable, right? You're busy. Why should you constantly conform to other people? Services should try to conform to you. And secondly, I'm not a huge fan of health insurance, of the whole system, right? Whole another conversation we can get into. It would go on forever. But as a whole, I am not a big fan of insurance. Therefore, I don't take a lot of insurance. But what I did decide to do, because I want people to still have access to acupuncture, is to change our business strategies, right? You can be affordable without having to run people through the nightmare of insurance. We offer mostly family plans by the month. And when you do your monthly family plan, whether it's two treatments a month or 4 treatments a month, nothing is more than $240 each month. That's for the 4 treatments a month. And then the 2 treatments a month is like $140. And anyone in the family in the household can get the treatment, right? The husband and the wife can swap. The wife can keep it all for herself. The kids can get one. And because it's all at one location. So for me, as the practitioner, I only have to go to one location and I can treat whoever's there. Another fun way that I try to keep the acupuncture accessible to everybody is I do pop-up shops, the infamous pop-up shops, right? And I do one at Everglades University. I do one at the Crunch Fitness over in Castleberry. I do all these pop-ups. And the Everglades is on Wednesday. The Crunch Fitness is on Monday evenings. And what I do is say, hey, I'll come to this location. And everyone who wants to come by and get a treatment is $55 for 30 minutes. And people really responded well to that. They like that, right? Because maybe they're already at the gym, they're already at the school, or they're already in the area, I have found, right? Like you work down the street and you know my pop-up is Monday evening at Crunch. You just pop in and get your 30 minutes, let me reset the clock, and you get on with your day, right? Those have been really popular. And with different prices, it really helps people, right? We don't have to bow to health insurance. If we can make a service that people would like, would need, and can afford, right? And that's how I do it. I do love B12. I do. However, with the quarantine and all that stuff, the supply chain of B12 from my sources has been not that great. The supply chain has been disrupted, so you can't get your hands on some of the real quality stuff. And rather than compromise the quality of what I'm giving, we're going to have to suspend that for a little bit until we can get everything back to the standard that it was. Because I'm not going to just go and pick a B12 provider that I haven't heard anything about and have never worked with. You know, like that's not going to work for my patients or for me, right? That's just not unacceptable. So for now, we're just going to do the regular treatments without the B12, but that we still do everything else. We still do cupping, right, which you may have seen in the Olympics a few years ago. We still do electronic stimulation of muscles. We still do air seeds, little ways of treating the whole body through the air as a microsystem. All the TCM, the nutritional counseling, the herbal counseling, all that, the fitness counseling, the emotional counseling too, sometimes it happens. All of that is still there. All of it's still there. Yeah, give us a call, check us out.
That's right, guys. You heard it. Check Dr. Haye out. And you can check him out at mobilehealingflorida.com. You can also visit his Instagram page at Healthy Leopard on IG. So, Dr. Haye, let me just thank you right now for this amazing interview. you taking your time out to not only answer my questions, but also answer the questions of our guests, and just being so informative and insightful and just giving us the tea on acupuncture. I'm so appreciative of you, and I cannot wait to do another interview and also to get my first acupuncture session. I'm really looking forward to it, and I feel like I am so much more knowledgeable now in the field of acupuncture. Dr. Haye, thank you so much.
Well, thank you for having me. It's been a great experience. I hope the listeners really got a chance to learn something new, maybe hear something different about how you can manage your own health care. And I hope they give acupuncture a try. Thanks for having me. Bye.